Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine, Consultant Neurologist. Today I am going to discuss with you about interpretation of arterial blood gas analysis. ABG is often a nightmare for students and interns. I am going to discuss this in a simplified way for the benefit of the interns, postgraduates, and consultants. So let us start. ABG analysis assesses mainly the ventilatory function. It also includes the estimation of the electrolytes, blood sugar, hemoglobin, and sometimes abnormal hemoglobin type, methemoglobin also can be detected by the ABG analysis. So when we say ventilatory function, we are mainly looking at the lungs. So during interpretation, we go by a step-wise fashion. So ABG is usually interpreted in a step-wise fashion. So step 1. In step 1, you should identify, look at the pH. The normal pH is between 7.35 to 7.45 and 7.4 is taken as the normal value. There is a middle value. When the pH is less than 7.35, we call it as acidemia. And when it's more than 7.45, it is alkalemia. So what is the difference between acidosis and acidemia, alkalosis and alkalemia? Acidosis is the process by which the pH is changing or acidemia is occurring. So that is the pathological process is the acidosis and alkalosis. Hope this distinction is clear too. So first step, look at the pH. What is the pH? Whether the pH is within the normal range, that is 7.35 to 7.45. Now we go to the second step. In step 2, we will be looking at what is the primary disorder. So step 2 is identifying the primary problem. So by primary problem, we will be looking at the PaCO₂, that is actually the ventilation, and we are looking at the bicarbonate, which is mainly looking at the metabolic, and that is mainly compensated by the kidneys. So step 1, look at the pH. Step 2, identify the primary problem. Is it a problem due to PaCO₂ or the ventilatory function, or is it due to metabolic? That is the bicarbonate. Hope this is clear. Now the step 3. In step 3, we'll be going and identifying the causes for the primary disorder. So what is causing the primary disorder? So I will explain this in little more detail. Okay. So basically the problems are, the primary disorders are, one, the PaCO₂ is increased, it is decreased. When the partial pressure carbon dioxide is increased, that means the ventilatory function is disorder is occurring, and it is when the PaCO₂ increases, it forms increase in the net bicarbonate. Sorry, increase in the level of carbonic acid, which will be acidic, gives more hydrogen ions and produces acidosis. So it is due to respiratory problem. So it is respiratory acidosis. So what is respiratory acidosis? The PaCO₂ is increasing. That leads on to decrease in the pH. Hope it is clear. When the patient is hyperventilating, for example, what will happen? The carbon dioxide is decreasing. When the carbon dioxide is decreasing, what will happen? It produces alkalosis. It is the carbon dioxide is washed out. So the pH will be coming down. So this is producing alkalosis, and this alkalosis is called it is due to respiratory problem. So it is called respiratory alkalosis. And so we should know what is the normal value for the PaCO₂ and PaCO₂. So easy to remember, 35 to 45 millimeters of mercury. When the carbon dioxide is increasing, it produces decrease in the pH, and it is a respiratory acidosis. When the carbon dioxide is decreasing, it causes increase in the pH, and it is respiratory alkalosis. Hope this is clear to you. So we have understood what is respiratory acidosis, what is respiratory alkalosis. Now we'll be looking into what is the metabolic problem. So the primary disorders are, as mentioned, one is the lungs and second is the kidneys. Kidney, this is the bicarbonate, and this here looking at the PaCO₂. So the respiratory is over. So when the bicarbonate is increased, it produces increase in the pH. So it is alkalosis, and it is due to metabolic. So it is called a metabolic alkalosis. When the bicarbonate is decreased, HCO₃ is decreased, it produces acidosis, and the process is by metabolic. So it is metabolic acidosis. So in the step 3, we are identifying whether it is producing a respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis. In the next session, we will be discussing a little more detail regarding the exact causes for the metabolic acidosis, metabolic alkalosis, respiratory acidosis, and respiratory alkalosis. Stay tuned. Thank you.